Welcome back to SeniorFlix. We're continuing our conversation with Lauren Smith-Baldi on Alzheimer's and dementia. So thank you, Laura, for just sharing your knowledge with us. I know we had some conversations where you helped us understand what dementia is. Now I guess we're gonna gear our conversations towards supporting the family members. It's really hard on the families and friends to know that something is wrong or something is not right, I should say. How do they start that journey of supporting their family and friends when they start recognizing those early symptoms?
Right. So we did talk about the earlier symptoms such as memory loss, having challenges doing activities of daily living that they could normally do, forgetting things, maybe misplacing things. And so one of the first steps is to get a diagnosis, and an early detection, an early diagnosis is key in providing best quality of life. And the reason for that is because sometimes we can have the person who's living with dementia be involved in planning for the future, talking to us about what they want, and engaging them in activities of daily living, engaging them in the things that they like to do, keeping them social and keeping them involved. That improves quality of life, but also there are medications available in the very early stages. They don't cure dementia, but they absolutely can be an integral part of slowing down the process.
So I love the thought that how you were mentioning about supporting the family member also includes that if you get it early on diagnosed and they are present with designing their self-care, it really does improve the quality of life. I know that sometimes when we're interacting with the families, when the residents have come in who are have progressed quite far in the disease, we're really solely depending on the family members to guide us. What would they like?
Right.
Because it's too late to ask that question.
Of course.
But how right you are to like have that, or be diagnosed early so that they can be involved in what kind of care they would like and plan it out. So important. Another question like related to that is sometimes there are neighbors that recognize that their friends are declining and they notice like the red flags. And now that you've given us some early symptoms, if they start recognizing that, what should they do? How should they approach their friend?
Right. So if their friend is exhibiting symptoms, it might be a good idea to talk to them. I'm concerned about your memory. Maybe you want to go to the doctor and have it checked. And then if that person doesn't have insight into their memory loss, you may want to go through family or close friends or the PGT or whoever is working with them to get that assessment done. Because one of the things that's so important is to rule out things that are treatable. It could be that they're just not eating well or that they're not getting sleep consistently. And as I mentioned before, that can mimic dementia. Alcohol use disorder can mimic dementia, and depression, isolating yourself, having memory issues, that can mimic it as well. And so once those things are ruled out, then at the end of the day, if you're left with a diagnosis of dementia, we go from there.
Okay. There's so many aspects to brain health, isn't it? I guess you've answered my next question that I was going to ask, where to go for help. And you said that it would be best to get the doctor involved, your family doctor.
Someone who's trusted, a general practitioner, we start there. And then if need be, we would get a geriatrician involved or a psychiatrist involved to do some of the testing that needs to be done. And again, you're going to be including all of these people in ruling out the possibility that it's not something else.
Okay, that's very helpful. How to diagnose dementia was a question which I think you've kind of answered with some of the information.
Yes.
And the route is through the medical line. And once that happens, what's the next step? What happens after that when you get diagnosed with dementia?
Right. So one of the things that we would highly recommend is getting in touch with the Alzheimer's Society of Toronto. So we have programs and support, not just for the family members or care partners who are providing the support to the person living with dementia, but also for the person who's living with dementia. So we have different support groups for persons who are having Lewy body dementia, Alzheimer's type dementia, and those are for family members. Separate groups, support groups. We have on staff 15 social workers right now.
Wow.
Yeah, and one of my favorite programs I'm so pleased that we have is what's called Care Navigation. And we'll connect with the person early in the diagnosis or later if need be. If the person's living in long-term care, they're also welcome to be a part of this program. Connect with them and guide them throughout the journey up until bereavement on what services or programs are available to them and provide that support for them.
That's excellent. So you actually are walking with them in this journey.
Absolutely, yeah.
From the start till the end. Oh, that's wonderful. So thank you so much for sharing that. We'll continue our conversation in the next segment. Thank you for tuning in and watching with us. And please come and join us for our next segment on this.